Oh my God, my heart is pounding like Yamira. But let's do this, right? Hello, everyone. I'm Kumari Regmi. Today, I'm going to share my COVID 19 story with you all. I haven't experienced any pandemic that happened before COVID 19. As we have heard in the news, nursing home was hit the hardest, and the nursing home that I worked could not escape the virus too, like so many others, and we fell the victim too. With each passing day, new cases of COVID 19 began to grow, and during the treatment, I managed to save lives of many, many people. But despite the success, I lost many lives. During that time, the visitation was banned due to uncontrolled transmission of the virus. Poor relatives, friends, family were eager to see their parents and grandparents in the nursing home. I call them every day to comfort the family, the patient's family, but at that time there was no vaccine and no hope. One day, an old mother was hit by COVID 19. I gave her family the opportunity to talk with their mother through FaceTime. The next day, the mother died. The family cried so much over the phone that they could not see their mother for the very last time. Although they could not see their mother, they thanked for the opportunity to do the FaceTime just yesterday. This was just one of the example that I made difference in my life being a healthcare provider, and especially during this pandemic. On May 1st, a tragic incident happened. While I was taking care of COVID patients, among those six of the COVID patients, infected patients, six of them died within 24 hours. I cried a lot, remembering my two little daughters at home who were 2 and 4 years old, and those patients that I took care of every day and the families. I know I was making a difference in people's life, but the meantime, I was worried about myself and my family. I had a lot of questions in my mind. What happened if my husband and I get tested positive for COVID 19? But unfortunately, on November 23rd, me and my husband both tested positive. At that time, I was 15 weeks pregnant. It was impossible for us to isolate from our two little daughters. So we quarantined at our house. Our elder daughter at least started wearing the mask, and she would at least understand a little bit of importance of wearing the mask. But our little one would take it off, saying, "I cannot see mommy's and daddy's face." And she would repeat it again and again. We didn't have an easy answer to explain to them at that time. I started getting bad headaches. Even the Tylenol could not alleviate it. I developed more symptoms every day, including nausea, vomiting, and the severe headache. I remember that day on November 28th, my headache was so excruciating that I told my husband to call an ambulance. At that point, I was at least able to keep some fluids down. So I keep sipping as I lay on my couch, and my big daughter would keep doing the warm compress on my forehead, and it helped. I took that Tylenol that night and went to bed. That next morning, I had some relief from that severe headache. And slowly I started feeling better. I was so thankful that I defeated the virus being pregnant and without being hospitalized. As a healthcare worker, I feel the need to give back to the community and spread the health awareness. So even though I was sick, me and my husband did a broadcast live on the Buddhist community in Syracuse page, Facebook, and raise awareness. We also did podcast on COVID-19. I feel so rewarded and satisfied to make differences in people's lives every day and educate our community. It feels so great to see my patients smile at the end of the day despite their pain and suffering. In conclusion, I want to tell everyone that vaccines are here. I encourage everyone to get the vaccine and continue to follow the CDC guidelines, staying at home, staying away from sick people, wear your mask, wash hands frequently, and socially distance. Thank you.